In high school, I was a competitive swimmer, and I used to be a lifeguard in the summer and took a whole host of first aid classes and CPR classes and things like that. And that's really what got me interested in treating someone in an emergency situation as it relates to health. The two areas that I really focus on primarily are newborn surgical procedures, babies that are born with congenital abnormalities that require surgical correction. Also, a disease called pectus excavatum, which is an abnormal development of the chest wall that requires chest wall reconstruction. We have a large center here that's one of only 5 centers of excellence in the country, where we have a multidisciplinary team that really takes care of all of the patients with chest wall issues that need to be repaired. I will usually give some options, but I always end by telling them what I think is the right thing to do, with the perspective of, this is what I would do if your child were my child. That really hits home, and I think as long as, of course you have to be genuine with that, and if you are and they sense that, I think that's where they get a lot of their confidence and trust. It came up just yesterday with a 19-month-old baby that has a very large tumor that we need to remove surgically. That was one of the last things that Mom said to me, which is not uncommon, which is, "I'm completely trusting you with my daughter." The older teenagers, they do want more information. A lot of the pectus patients that come to see me have found me on the internet and go to their parents and say, Mom and Dad, I have this thing in my chest. A lot of times the parents don't even know yet. And I want to go to Cleveland and I want this doctor to take care of it for me. I play the piano. I write and record my own music. I've been doing that for, a few decades actually. So I'm still very active with that. I race sports cars competitively, which is exciting. I'm an avid skier as well, so I keep pretty busy.